Hello. We did our presentation on March 10th, and all the agencies and community members that came out gave us such good feedback that we decided to go ahead and record the same presentation so we could send it out to everyone who wasn't able to meet us or be there with us. So enjoy.
A healthy system requires permeable boundaries, meaning feedback is flowing in and out all the time. A forest, for example, is a living, breathing system that is essentially permeable. Water, oxygen, sunlight, and living creatures are moving in and out of it all the time, giving and receiving all kinds of elements of life. And it is that motion that keeps it alive and vibrant.
We at Karen Share are committed to becoming a healthier, more vibrant system by leaning into this concept of permeability. We thrive when we are continually giving and receiving feedback.
Over the past 2 years, we've been conducting a thorough assessment of the communities we serve. And this is the first time we've ever done something on this scale. So this is new. This presentation and this recording is an example of how we are committed to being intentional about how we show up in our communities and how we share with you the feedback we've been receiving. These are the first steps in a journey towards becoming the vibrant, flowing, thriving system that responds to and is driven by the voices of our community.
So today, we are here to share with you what we did to hear from our neighbors, our communities, what we found out, and what we're going to do about it.
The feedback we received from the community highlighted these three priorities: advocacy, culturally relevant food, and an agency academy. Keep your eye out for those icons. They're going to show up again.
Hi, everybody pretty much knows me. My name is Barbara Reckel. I'm the regional manager for the Pikes Peak region, which includes El Paso and Teller counties. And that means that I get to support our partner agencies and volunteers that serve our neighbors.
And my name is Nadia Fisher, and I'm the Service Insights and Analytics Manager for Care and Share. This means that my job is to collect and analyze information about the areas and the neighbors that we serve.
So as we go through the presentation, you're going to hear us use a lot of words. We thought it'd be nice to start with the definition. You'll hear us use neighbors a lot. We prefer to use neighbor instead of client or guest because we believe that anyone can need help at any time, and the people that access our pantries are our neighbors.
And when we use the term partners, we mean the agencies and organizations who have partnered with us to distribute food to the 29 counties in our service area. Care and Share brings in food through donations and purchases, and then we ship it out to our 287 partner agencies who distribute it to our neighbors every week. We literally could not do what we do without them, and we appreciate you all so much.
Yeah, we've been fighting hunger in partnership with these organizations for 50 years now. And our collaboration with these partners has largely driven the direction of our programs. Our new vision adds neighbor voices and feedback as elements of our ecosystem.
So about 2 years ago, our national organization, Feeding America, gave us an assignment. They asked us to do an assessment of our service area, to look for areas where people weren't getting what they needed, where the geography of our state might be an issue, where individuals were facing barriers based on their culture or language or origin, or basically where our passion for equity wasn't quite achieving what we wanted it to. We thought these were excellent questions, and we responded enthusiastically. This was an opportunity to hear from our communities, and we didn't want to waste it. But it's a big ask. We serve 29 counties across southern Colorado, and they are very, very different from each other in geography, in culture, and in, let's call it personality. Some of our counties are very proud of their independence and rugged individualism, while others value a sense of community and connection so highly, while others are caught up in the hustle and bustle of urban life. If you've ever tried to get across town about 5 p.m., you know what I'm talking about.
So we loved the idea of hearing from our community. but we really didn't have a process in place that would allow our neighbors to speak directly to us. So we've had the voices and insights from our Care and Share staff who've been doing this work for a long time and who are truly experts in what they do. And they do incredible work, especially our drivers.
Give us a woot woot if you love your driver from a distance.
Our colleagues have built strong connections with our partners, but we were not hearing directly from our neighbors.
So to really find out what our neighbors need, we embarked on a project. We conducted 11 listening sessions in 7 counties with both partners and neighbors. We rolled out an online survey that gathered almost 2,000 responses in 9 months' time from across our service area. We looked at Feeding America data, census data, and our own internal data, including neighbor intake data, and we wrote a report. It's 82 pages.
So, what do you think we heard from our southern Colorado neighbors?
Many neighbors left comments describing their experiences with hunger, food access, and food pantries. One neighbor said, "I can afford unhealthy, inexpensive, prepackaged garbage, but we can rarely afford fresh fruits and vegetables on a regular basis." Another neighbor commented, "I do get food stamps, but despite my efforts to scrimp and save, I run out at least 1 to 2 weeks before the next month." Our survey also included the Food Insecurity Experience Scale, used worldwide by organizations like World Hunger to quantify the experience of hunger. This scale asks 8 questions, such as, during the last 12 months, was there a time when, because of a lack of money or other resources, you were worried you would not have enough food to eat? Please note the phrase, because of a lack of money or other resources here. So when the question asks if someone skipped a meal, we're not talking about fasting or dieting. And some of us may have gone a whole day without eating for a variety of reasons. But here, it's because there was no food available. So when someone answers 7 or 8 of these questions with a yes, they're considered severely food insecure. By contrast, up to 3 yes answers is considered food secure. Our survey showed that 54.2% of neighbors in southern Colorado identified themselves as being severely food insecure. Another 26.7% showed moderate food insecurity, meaning they answered yes to 4 to 6 of those questions. Another question on the survey showed that 9.8% of neighbors reported experiencing disrespect from staff or volunteers at a food pantry. These are some examples of comments from neighbors who answered yes to that question.
So, neighbors also answered a question about barriers, things that prevented them from accessing free food. And as you can see here, 74% of our neighbors identified transportation as a major issue. One neighbor commented, "I have a difficult time getting the food home." 32% of neighbors said that the hours our partner agencies were open were a barrier. In the comments section on the survey, they expressed difficulty finding a pantry open outside of work hours, around appointments, whether or the amount of time needed to stand in line to enter the pantry. For example, one neighbor commented, "For people that work traditional full-time hours, it's nearly impossible to get to a pantry during the open hours."
Neighbors across southern Colorado told us in comments and focus groups that what drove them to seek our services were things like insufficient benefits, disabilities, illness, mental health issues, or family circumstances such as death, divorce, domestic violence, or other impacts to income and financial situations such as moving, homelessness, high costs, or lack of employment. Neighbors expressed a lack of information, not knowing where to go to access free food, not knowing what the requirements were, or whether they would qualify, or trouble navigating the system or website. Neighbors also frequently expressed gratitude for the services that they were receiving. They talked about pantries, treating them with respect and dignity, and showing kindness and compassion.
So, what did we actually hear from your neighbors here in El Paso County and Teller counties? Well, in El Paso County, 58.6% of the neighbors reported severe food insecurity. Now, that's 4% higher than the Colorado overall that we saw earlier. And another 26.5 reported moderate food insecurity, which is about the same. Now, 66% of the respondents to the online survey were from El Paso County. So just take that into consideration. All right, so we also sent out surveys to our partners. So what did our partners have to say here in El Paso and Teller counties? Here are some of their comments about their frustrations and challenges. Now, I want to point out here that all of these comments are about partners wanting to do more for neighbors. Partners want more resources so that they can expand services and meet neighbors' needs more effectively. Consistently, the highest concern from both responses and comments was funding. So in El Paso County, these partners are more likely to get funding from food drives and less likely from grant sources. 22.6% of the partners use websites as a funding source. Now, when we asked our partners about sustainability of their pantries, 89% indicated that they have plans, they have resources and places to continue their services. 30% also said that there were some changes that needed to be made soon in order to continue serving their neighbors. So our partners want to do more, and our partners indicated a need for increased capacity, both human and physical, and many also requested more information, training, best practices, resources, connections with other entities in our community.
So we've learned a lot from both our neighbors and our partners. But I want to be clear, it's still not enough. The data is not complete, it's not nearly comprehensive enough, and it doesn't cover all of the areas we wanted to hear from. But what we did get is a snapshot and enough information to show the things that are currently going really well and highlight some opportunities for growth.
So what's next?
We have an opportunity right now in this moment to become a community-driven organization. We want you, our partners, our neighbors, our community members to be driving the bus, not just passengers on it. We want our neighbors who visit our partner pantries to be able to tell us directly what kinds of foods and experiences they're looking for. And we want you, our partners, to know just how much we value your opinion as the experts we lean on to accomplish our mission. So how do we make sure that we're hearing from you? What can we do to make sure that the voices we're hearing aren't just the ones in our heads or the loudest ones in the room, but that we are consistently, regularly, and equitably listening to all of the people that we serve?
So this service area assessment indicated several areas of focus, and based on community feedback, we narrowed it down to 3 major priorities for this coming year: advocacy, culturally relevant foods, and agency academy. So what does that mean? Those are good questions. Since each of these terms mean lots of things, our working groups will define the focus of each concept. For example, advocacy could mean advocating for our neighbors to have better information about services and access to services. It could mean advocating to local and federal government entities about our neighbors' needs, but it could mean collecting neighbor stories and feedback to drive decision making.
Culturally relevant food could mean easily digestible foods for our senior populations. It could mean foods that don't require kitchens for our unhoused populations. It could mean foods that are culturally appropriate and significant for our Hispanic or Native populations. It could even mean foods that are tailored to specific medical diets.
Agency Academy could mean training for partners by neighbors about crafting a more positive neighbor experience. It could mean facilitating conversations between community entities and partner agencies for more effective collaborations. It could mean training in best practices led by existing partners. And it could mean workshops on fundraising and grant writing. Since we want to be a community-driven organization, we're asking you to join us in this work.
A steering committee made up of Care and Share staff, partners, volunteers, and neighbors has already formed and is currently creating a plan of action. This involves creating multiple working groups across our service area, who will then be doing the hard work of researching and choosing the best path forward in each of these areas.
Our working groups will consist of teams of Care and Share staff, partners, neighbors, and community members, and address each of these priorities as they relate to each specific community.
In other words, we're letting the community decide what we do, which means we don't really know yet what these plans will look like, and that's on purpose. But this process involves a lot of people, and if you want to play a part, we would love your help. Scan this QR code, and we will connect with you about more details. If you have questions for us, please feel free to reach out, send us an email, respond to the email that you received this presentation in, and we will do our best to connect with you and communicate. Thank you so much for joining us today.